I don't know few things that who will be the audience.
Ma'am, the audience is the oncologist and general physicians. So, with all your due permission, we are beginning with the session for today. Good afternoon, everyone. This is Batul, the moderator for today's session from IGCP Group, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is present here with us today. Well, she needs no introduction, but yet it's our great pleasure and honor to introduce her at our platform. And she's none other than the very renowned radiation oncologist, Dr. Anita Malik, ma'am. Ma'am is MBBS, MD in Radiotherapy Oncology, Radiation Specialist, Oncologist, and Clinical Lead at IOCI Fortis Hospital, Noida. With ma'am's wonderful insights, we are going to talk about the topic for today, which is cancer screening and prevention. As this topic needs a lot of emphasis, who else could have been better than ma'am to talk about this topic? So now, without any further delay, I would like to welcome ma'am at our forum and would like to hand over the session to her for her precious talk to begin. Ma'am, over to you. Please proceed. Ma'am, are you there? Hello? Dr. Anita, ma'am, are you there? Hello? Ma'am, are you there? Okay, I think there's some network connectivity issue that is taking place. Ma'am, can you hear me? Ma'am, are you there? Hello?
Production. So today we increasing. Yes, yes. Am I? Yes, yes, yes. I'm able to hear you.
Okay, ma'am. Actually, previously we couldn't hear you. There was some network buffering that was taking place. Please continue.
Okay. So, uh,
Ma'am, I
it's
would
very good
suggest you
afternoon
if
after
you can.
a very nice introduction. So we are going to discuss describing you of deadly evil, which is increasing in numbers, incidences. So we are sitting on. So I will change my otherwise. Okay, I'll change my location. Give me 2 minutes.
Sure, ma'am, sure.
If there is a problem, I will change my location. Am I audible now?
Yes, ma'am, much better than what previously it was.
Okay.
Yeah, you can continue, ma'am.
Yeah, my screen is
Ma'am,
visible to
yes,
you.
yes. Yes, now it is visible, perfectly visible, ma'am. Please continue now.
Okay, okay. I'm sorry for the technical glitch. So we were discussing about the cancer. So this is a known deadly evil, and the incidence is increasing. So whatever is reported or uh, written in the literature, the problem is far, far more than that. Means uh, one third of the cases they are not reported. The patients, they don't go to any health care professional or a hospital. So as the incidence is increasing, we need to uh, take special attention or measures to reduce the incidence. At least uh, we can prevent the modifiable risk factors which is associated to our lifestyle, to our habits. So first of all, cancer, this term is derived from a Greek word, means Scorpio, and it slowly and gradually engulfs the human body. So there are certain few terminologies associated with this. First is cancer, that involves a group of disease that characterized by uncontrolled growth and of these cells, and which spread to other normal cells, other organs. So that is cancer. Neoplasm is a new growth of a tissue that serves no physiological functions. Means a cancer which arises from a organ. Uh, the cells, those tissue, they does not serve any physiological function from which it is originated. Like if it is originated from a kidney tumor, so those cells will not filter your blood, will not produce the urine, normal urine. So another term is malignant. This means the tissue is cancerous. It can spread to the other tissue, other organ. And benign tumors, you might have heard this term, and it means it is not cancerous. It may not spread, but it can invade local structures. It can increase the size, and it can, by the virtue of these things, it can produce symptoms due to increase in the size and can cause pressure symptoms. So talking about this global problem, in males, the worldwide prostate cancer is a commonest cancer, followed by lung and colorectal. In India, head and neck cancers, especially the oral cavity cancers, is commonest group, followed by lung and stomach. Talking about the females worldwide and as well as in India, the breast cancer is the commonest one, uh, followed by colorectal and lung worldwide. And India, cervix and colorectal cancer, these are the leading cause of cancer related mortalities. These contribute the most. So the cancer is the cause of 12% of all the deaths in India. So suppose 100 patients are there dying because of uh, uh, various problems. Among that 12%, 12 patients, they are the cause of death is cancer. And there are 2 to 2.5 million estimated cancer cases at any point of time. So at one point of time, these many patients are suffering from cancer. And every year about 10 lakh new cases they are detected in India. That means this is the incidence that is reported. But as per one study, this is just like 2/3 of the cases. 1/3 cases they are not reported. So the actual number is much, much higher than this. So every year there are 5.5 lakh cancer patients who die in our country. and 70 to 80% cases, these are detected at very late stage. So the treatment outcome of, as we know that the treatment outcome of cancer in stage 3 and stage 4 is poor. This is the reason why the mortality is high in our country. So what are the reasons why the cancer incidence is increasing day by day? Because the death from other diseases, infectious diseases, is reducing because of the improved healthcare system. The childhood mortality is reduced. The longevity of the general population is increased, as we know that because of the improved healthcare system, the mortality age, average life expectancy of males and females has been increased. So the cancer risk increases as the age increases, and therefore the incidence, reported incidence is increasing. So other reasons like adoption of Western lifestyle, like smoking, higher consumptions of saturated fatty acids, consumptions of calorie-dense food, and reduced physical activity. These are the major causes of increased cancer incidence. These are like confounding factors increasing the incidence. So cancer can affect any site of the body. It from brain tumor to anything like head and neck cancer, lung cancer to GI cancers, because this cancer term is a very big, huge, wide range of diseases. So even talking about one cancer like lung cancer, there are approximately 7-8 type of cancers, like squamous cell, adenocarcinoma, small cell, the neuroendocrine, sarcomas can happen in lung cancer. So the treatment of these different types are different. So lung cancer is not, it itself is a group of cancer. So survival rates are poorer in developing countries because of lack of availability of healthcare facilities, and there is lack of early detection due to because there is scope of improvement in screening programs. Early detection helps in complete cure of some cancers. So prevention should be taken so that we should have a like healthy lifestyle. The other factors, at least whatever in our hands, whatever we can modify, we should adopt that lifestyle. So these are the reasons. One by one we will discuss the reasons. Excuse me. So one by one we are going to discuss the etiology, the risk factors which we can modify to reduce this incidence. So the most commonest cancer, as we were talking about in the earlier slide, was oral cavity or head and neck cancer. Here the major cause is substance abuse, and the most common substance is smoking, whether it is an active smoking or a passive smoking, or maybe like e-cigarettes, the most talked about topic these days. So these all are harmful, and smoking constitute 30% of the all cancer deaths. Like if the 100 patients they have cancer, they are dying, 30% is because of the smoking. This is that high. And in those patients, 87% are lung cancer. And lung cancer is directly associated with this smoking. We all know that. The consumption of tobacco in the form of kheni, zarda, and gutka also causes cancer. So this is not smoking, this is direct contact with the tobacco. And this tobacco is a carcinogenic, and it get absorbed through our skin, our mouth, our mucosa. So it is a major culprit. So another one is alcohol consumption. that led to oral cancer, oral cavity, pharynx, larynx, esophagus, stomach, liver. So all of these cancers, here alcohol is another factor. In liver it indirectly affects. So alcohol destroy the liver. We all know that, and fatty liver followed by liver cirrhosis, and after cirrhosis there can be a chance of hepatocellular carcinoma. So earlier it was known that the hepatocellular carcinoma is because of the viral infection. Post viral infection, there is scarring, there is fibrosis, and the hepatocellular carcinoma can develop in those cases. But now these days, metabolic causes is also increasing, and in which the alcohol is the number one culprit. The people who drink and smoke further, there is risk of developing cancer, because they now the two factors they have the add-on effect. So talking about the diet, high intake of fat increases certain cancers, like cancers who are associated with obesity, like breast cancer, postmenopausal patients. These have a high risk of developing breast cancer. Although we are getting early breast cancer patients too in young patients. So another cancer is the colon cancer. 40% there is high risk of colon cancer. So high diet and high protein food, high fat and high protein food with grilled at high temperature produces chemicals that have carcinogenic effect. So smoked food should be avoided in our diet. Highly brown and charred food has cancer causing compounds. These compounds are like sodium nitrate, and when this is ingested is a potential carcinogen. Other are nitrosamine. So chemicals and pollutants, talking about this, the air pollution may cause cancer. There are many things there can be asbestosis, and in industrial plants associated with the rubber industry, paint, dye, coal tar industries, these are known carcinogenic. So cancer incidence is increased, have been seen that increased in the workers of these industries. So water may contain cancer causing substance that industries can dump their material, and this directly water, if pesticides and herbicides residues, these are also carcinogenic. So one should minimize the use of these things, and should rely more on the organic these things. So radiation may stimulate development of cancer, and repeated x-rays should be avoided. This fact we know that during the COVID there was high alert that people should not go for CT scans very frequently. That increases the incidence. So stress is implicated in increased susceptibility to several type of cancers. Sleep disturbances may weaken the body's system, and there are certain cancers who are known to increase in patients having low immunity, especially with the HIV patients. There are certain cancers like Kaposi sarcoma, cervical cancer. These are lymphomas. These are more in low immune patients. So genetic factors, some cancers such as breast cancer, stomach, colon, prostate, uterine, ovary, and lung cancers appears to run in families. And there are certain gene testing that is available with those patients. The patients, they have advice for genetic testing. If there is high risk, the close family relatives, first degree relative, or multiple second degree relatives, they have like history of malignancy. So in that case, a doctor advised genetic testing. Am I audible?
Yes, ma'am, you're audible.
Okay. So certain infections, they are also associated with the cancer, that human papilloma virus HPV infection increases the risk of cervical cancer. Especially, there are few stains who are associated, and the vaccine against this HPV infection that is protective for cervical cancer. Vaccines are available for this. And for liver cancer, the hepatitis B infection C, and these are associated with the liver cancers. And throat cancer also, HPV infection is associated in approximately 15% of the cases. So altogether, when we see the percentage contribution of malignancy with different factors, 30% smoking, alcohol use, the unbalanced diet, the lifestyle, that contributes again 30 to 35% of the cases. 18 to 20% of the cases with chronic infections, as we discussed in previous slides, 18 to 20% in hormones. Here in hormones, breast cancer, uterine cancer, these are the major cancers. There can be others, and 2% occupational and 1% population pollution, as we discussed. So, talking about the individual cancer, we will discuss few major cancers. The incidence are high. So number one is head and neck cancer. Overall, when we see the male female, although in females breast cancer is common, but when we are talking about overall in India, head and neck cancer is common. So patient may present with persistent white or red patch, usually painless. Painful ulcer doesn't mean malignancy at every time, because pain increases or involves only when there is nerve involvement is there, when the size increases and it is involving the nerves. So that is a referred pain due to nerve involvement. So very small ulcer, if it is painless, maybe a malignancy. If it is not healing, it has very bad margins, very dirty margins, can be malignancy. Any other persistent lump, swelling in neck, there can be persistent cough, hoarseness of voice, especially with a vocal cord tumor, means the voice box tumor. The patient present with change in voice. The feeling of foreign body sensation in throat, difficulty in swallowing. These are the symptoms. Here, the most major culprit is the smoking, tobacco consumption, and alcohol consumption. These are the common etiological factors associated with head and neck cancers. So, second number, the lung cancer. This is highly aggressive because the tumor is deep-seated. The symptoms occur in very late stage. And the duplication potential is very high in lung cancer. So these are aggressive. Again, the symptoms may be persistent cough, blood-streaked sputum. There can be chest pain. And how we can prevent this? By avoiding smoking. And another risk factors are environmental pollutant, and screening may prevent this. Although in guidelines it is not recommended, only a small group of population in which the age is 55 years old male, if it is a heavy smoker, in that case only the low dose CT scan is recommended in those patients as a screening. It is not for general population. So talking about breast cancer, it is the commonest cancer in females. 1 out of 8 women will develop breast cancer. This is lifetime risk. So it is that high. The symptoms may be lump in breast, thickening of skin, nipple discharge, distortion, or tenderness of the breast. So these are the symptoms. Sometimes we are getting screen detected cases also. For females after the age of 45, it is recommended that every females, irrespective of any symptom, whether she's not or feeling any lump, should undergo X-ray mammography. Normally, the mammography is the test. If it is not described, mammo means the X-ray of the breast. That is a very simple test, cost effective and very cheap, and we can advise it to even a poor person. So risk factor here is the family history. 15% approximately to 20% cases, they have a family history, they are genetic, gene related. Other risk factors is the nulliparity, means not having children. Long menstrual history means early menarche and late menopause. The females who in which the menstruation starts early at age maybe 9 years or 10 years and continued for a longer period like 50 or more than 50 years. So these patients, they have more tendency of developing breast cancer, because the breast cancer is a hormone dependent cancer, and these females, they are more prone for variation, for longer period of variation of these hormones. So they have increased risk. Again, the obesity, oral contraceptives, there is smaller study came which which showed that there is some association of oral contraceptives and breast cancer. There was one study which we saw. So talking about treatment, if we detect the patient in very early stage, the lump is very small, so in that case, we can save the breast. The morbidity will be less. So lumpectomy, wide excision will help. But if the tumor is big, in that case, radical mastectomy is required. You might have heard the term MRM, modified radical mastectomy. So the breast along with the lymph nodes are removed, and depending on the stage, further patient may advise for a chemo, immuno, or targeted, and followed by radiation. It all depends on the stage. If we detect it early, the surgery might be required, and that too a conservation surgery. So what is preventive? For screening, mammograms and regular breast self-examination is advised to the general population. There are a lot of videos on YouTube which showed how you can examine your breast, what is the best time, and so what should be the frequency. A lot of videos are available on YouTube. So to maintain a proper or good lifestyle, but should exercise and take care of her health. So another cancer is colon and rectal cancer. It is a cancer of elderly patients, more than 50 years, obesity, family history of polyps, patients with high fat and low fiber diet, they are at risk. Again, smoking and alcohol consumption, these are the risk factors. So again, the treatment, if it is localized, small disease, can be surgically removed, and depending on the stage, further chemotherapy, targeted therapies, and radiation, these things are required. So how we can prevent these? These 90% of them are preventable, as with diet modifications, regular exercise, as we mentioned in earlier slides. So prostate cancer, it is one of the commonest cancer in men. 1 in 3 men will diagnose with this cancer in lifetime. So this is again a very common, and this cancer is cancer of elderly people. Most of the time, the patients are in their late 50 or late 60s. The symptoms are weak and interrupted urine flow, difficulty in starting or stopping the urination, urgency and frequency of urine. So these symptoms can occur in a BPH patient, mean benign prostatic hypertrophy. This is benign condition in which the prostate size enlarged And this is very common after the age of 60 years. The patients who came with us with these symptoms, we used to advise them a blood test, that is a tumor marker, that is known as serum PSA level, serum prostate specific antigen. So that is a tumor marker. So we can differentiate BPH with the malignancy with that simple blood test. So, and further tests are advised to diagnose this condition. So, talking about prevention, again, diet with lycopene and vitamins can help. Another is the testicular cancer that affects men between the 15 to 35 age. These patients, they have greater risk. Although highly treatable, it causes lot of morbidity. So the testicular tumor, although it is treatable, but if not diagnosed early, causes lot of morbidity. And for that, there should be one should practice a regular testicular self-examination. Again, you can see the videos in YouTube. Talking about cancer, in total, there are 7 warning signs of cancer. Change in bladder or bowel habits, a non-healing ulcer or a sore throat, unusual bleeding and discharge from orifice. Means there can be hemoptysis, there can be hematemesis, there can be pervaginal discharge, there can be bleeding through rectum while passing stools. So these are the broad terms. Thickening or lump in breast or anywhere in the body. Indigestion and difficulty in swallowing. Obvious change in wart or mole. Very important. If the mole is suddenly increasing in size, it ulcerates, there are more chances of developing into a mole associated malignancy. Nagging cough and hoarseness of voice. Again, these are the 7 warning signs of cancer. 1 or 2 or maybe more symptoms may be associated with one malignancy. So talking about the treatment modalities, majority of the cases in early cancer, surgery is the treatment of primary treatment. So this is the old tested treatment. Surgery has a role in early stages, and sometimes you might have heard at the preventive surgery. Patients with genetic testing positive, they go for a prophylactic mastectomy. You might have heard about the Angelina Jolie. So she underwent bilateral breast removal because she was high risk case BRCA positive. So there are preventive surgeries too. So there are a lot of advancement that haven't taken place in past years, and depending on the stage, the pathological stage after surgery, patient may or may not be advised for further treatment like chemotherapy and radiotherapy. So because the radiation is my specialty, I will take few minutes on this. Radiotherapy is a very safe and widely used method for treatment. It requires no surgery in few cases like voice box tumors. It is organ preserving. You need not to take out the voice box if it is comes in early stage. Bladder cancer, and so these cases, this is organ preserving treatment. There is no pain, there is no burning or other sensations. Side effects are very mild and become less with newer technology. Teletherapy and brachytherapy, these are 2 modalities depending on the tumor type, it is advised. So chemotherapy means a treatment in which drugs are given in the form of tablets or either injection. The side effect profile has improved much with the newer, better drugs. You might have heard about the targeted therapies, the immunotherapies, which are developed in the later part, and they have very specific side effects with the toxicity profile is much better than chemotherapy with those drugs. and these are used with combination with like surgery or radiation, sometimes chemotherapy alone, so depending on the type of cancer. So concluding this talk, the cancer is increasing incidence in India as well as worldwide. Prevention by we can take by taking some precautionary measures as we described in the and best way is to prevent the cancer. The early detection saves our time, efforts, money with the superior results. Early we detect, early the good prognosis will be, so morbidity will be less. The treatment are complex, but these are rewarding these days. The follow-up is must to prevent cancer from coming back. And with newer technology in treatments, treatments are the results are promising. So thank you. You can find me on Google, and there is also Insta page, as I mentioned. You can reach me out there.
Ma'am, thank you so much, ma'am. Thank you for your kind words and for such a lovely presentation that you have shared. It was overwhelming for our viewers to understand and to know about the topic in such a better manner. Moving ahead with the question and answers, we have received a question. So with all your due permission, I would like to put across those questions to you.
Yeah, please.
The first question is related to the recommendations. So what are the current recommendations for lung cancer screening and how do you implement them in practice?
Okay, so lung cancer screening, as I told you, is not advised for worldwide population. To specific individuals, like the age of more than 55 years, and if the patient is a heavy smoker, in those cases only the screening is recommended. One thing I want to tell you, what is screening? Screening is a test which is advised to a worldwide population when there is no symptom. The patient has no symptom, there's no cough, there is no weight loss, there is no lump, nothing is there. So in high risk cases only screen is recommended, especially in lung cancer.
Thank you so much, ma'am. Thank you for answering that. The last question is about the lifestyle modification. So what lifestyle modifications do you most commonly recommend to patients to reduce their cancer risk?
Okay, so as I told you, diet modification, your diet should be rich in with antioxidants, fruits, you should take fruits. To maintain weight according to your height, you should do regular exercise, do not smoke, do not limit your consumption of alcohol. Okay, as I told you, avoid taking smoked food. So because there are certain cancers who are related with the obesity, high fat intake, high calorie intake, as I described in this lecture.
Thank you so much, ma'am. Thank you. With all your lovely comments, we would like to conclude the session here for today until next time. And we would like to thank all our viewers for their ardent participation that they have shown by staying tuned with us throughout the session.